wine.
And so I just say in general, like as a commentary as a student, I think one of the challenges of the DAOM program, being that it's in its infancy right now in terms of the East Asian medicine programs in the United States, is where are we going and how are we going there? I definitely saw a need for, like, so many doctoral programs right now are focused on like a clinical doctorate, but what about like how are we making room for the academics and the teachers in that realm? Like, most of these doctoral programs are geared toward practitioners, so I would like to see a broadening of the DAOM programs in general to allow all sorts of, anyone who's interested in, whether they want to do academic research or whether they just want to become an extremely proficient clinician, to both of those camps get something out of the DAOM.
Okay, questions from our audience, Dr. Redwine. Okay, Dr. Redwine.
I just have, it's kind of a follow-up on what you guys were talking about, and this isn't really my area of expertise, but I'm wondering, it seems like, that the Nei Jing is the essentials, it's the fundamentals, and that we need to, have those in order to learn, the clinical aspects as well. So I'm wondering, so what happens if we don't include the Nei Jing in the curriculum? What happens to those practitioners? What are we losing when we lose the philosophy behind the clinical practice?
That is a great question, and I think truthfully it goes back to Dr. Gomes' actually Sonia, Dr. Pritzker's comment about ideal versus real world. So in my mind, and in the minds of a lot of sort of Nei Jing scholars or classical scholars in both the US and in China, we lose something of the essence of the medicine if we don't understand the foundational text. It's a really tough sell, and this is one of the things that I was continually challenged about doing this research is, well, how much are the master's students really losing by not having a class on the Nei Jing if we, as I said, the major state board textbooks include little sections of the Nei Jing in there. Unfortunately, taking those sections out of context of the greater chapter, the greater whole, each chapter of the Nei Jing at the most is about 5 pages. The biggest chapter is probably 5 pages. So they're very compartmentalized, they're pithy, they tell you exactly what's going on and they pretty much stay focused on a given topic. The challenge is, I believe you're asking a question which would be very challenging to prove, and this is one of the things that I struggled with. Initially, I thought, well, what if I looked at like state board pass rates for schools that teach the Nei Jing or one or more classics as a requirement versus schools that don't? Like that may be one way to go about it, but as you're probably familiar, like having exposure to this field, Chinese medicine, its greatest strength and theoretically its greatest weakness is that we can come up with a theory about basically anything, and we can use Chinese medical theory to prove it. To prove any part of any argument, and that's one of the major challenges. So, are we losing clinical efficacy in our practitioners? I don't know if we can really, if that's something that can be measured in the same way that, as I'm sure you go into in the research class, how do you design an accurate acupuncture study? Designing an accurate herb study or an accurate double-blind placebo study for someone getting herbs or pills, that's easy. But how do you do it for acupuncture? And people have been struggling with that for at least 10 years of, are we going to use the sham acupuncture model, or how are we going to do that? And to me, this is where we get into that schism between scholars and practitioners. And scholars will all say, you need to understand the foundations, like, and even trying to put it into my own words, if somebody asks me, well, how does the Nei Jing inform your clinical practice? I don't really know, because I've read the Nei Jing so much that my original copy is literally pages are falling out. And every time I go back, I learn something new. But it's so fundamental that it sort of goes, it almost bypasses the rational mind on some level. So it just becomes part of what you do. So I don't know how we could accurately answer the question of what are students losing by not getting the Nei Jing. The only way we can even get close to that is what these elders in China are now saying, which is we believe there's been a weakening of the medicine since the TCM model became the standard. And in China, the guy that I did the final quote from Li Hong Liu, they gave him permission at his university to design a classics-based curriculum. They gave him free rein to do this. And so there are some curricula in China that, there at least one, that's doing this. So we might be able to, in the future, look at that curriculum. But again, this has been a matter of contention since TCM education, or in general East Asian medicine education, came into consciousness, because there are some people that believe the Nei Jing is very simplistic when you look at it. It is just about yin and yang and qi, and what is qi, and do we need to talk about qi, or do we just need to become skilled technicians where we do the right point and that's enough? And as Dr. Goem said, we are dealing with a model, an imperfect model. We are making sacrifices at every level of curriculum design. The herbalists probably feel like they need more herbal education. The acupuncturists probably feel like they need more acupuncture education. I remember at the school that I went for my master's, 5 branches, and then later taught herbs at, there was an email exchange that happened between myself and another teacher, and this teacher had been lobbying for several years that Herbs 1 should not be taught until 2nd semester. And I argued against that, saying, well, it works, it's worked for me and countless classes here at 5 branches to learn herbs in the 1st semester. Their argument was, well, you have to teach theory concurrently with herbs, and so it's this sort of dance you have to do, because how do you say, don't use ephedra in cases of yin deficiency if the students don't know what yin deficiency is? So it falls upon the teacher, and this is the thing about TCM education. Any teacher of any given class really has to be knowledgeable on multiple other subjects within the field, and the classics is just one. So like my comment to this teacher was, well, then you shouldn't teach anything until 2nd semester, until students have mastered yin-yang theory. And like, because how do you teach foundations? How do you teach anything until the students really know the basics of yin-yang theory? What does qi mean in a Chinese cultural context? Because for us, as Westerners, it's this one specific thing that most often is translated as energy. But in China, there are literally thousands of uses of the word qi, including, I am going to put qi in my car, which is, I'm going to put gas in my car. Like, qi is such a pervasive concept. How do we teach without?
So my question, as well as is the so what question, which is the basis of your capstone.
Right. Which
is, if we don't teach it, what do we lose? Why are we teaching this? Why is it essential? And how will this improve, Eastern medicine? So that's why I was wondering that because that's part of.
Probably the answer that I would go with, given that more specificity of that question, would be, we're rapidly moving toward an integrative medicine model, whether we like it or not. My idea, and as far as I'm concerned, and I've talked to my students about this and other colleagues, integrative medicine, that term means nothing, and it's up for grabs. And so my own personal vision of what integrative medicine is a master of Chinese medicine being able to dialogue with a master of Western medicine. I don't believe that we should be creating a watered-down system of Chinese medicine which includes proficiency in biomed. I think there's room for that, but I think to create a true integrated medicine model in the United States, we need a dialogue amongst knowledgeable practitioners. And to truly be able to dialogue about Chinese medicine, in my own experience, and again, I really don't feel like this is something that can be tested other than what's already happened in China, which is, a generation of practitioners coming along and saying, the medicine's no longer as effective for treating these conditions, or the students aren't as effective at the practice of medicine because they've lost these core foundational theories. They don't understand them as well. I don't know how we're going to see that, and that's why I'm sort of using this new dialogue that's coming out of China as sort of an oracle into the potential of what could happen in America, because I see that happening. I see that there is a desire to integrate, and that integration should not come at the expense of any of the systems that are going to integrate. We should all, yes, I think it's important for everyone that comes out of school to understand that if a doctor tells them, says creatinine or elevated ALT, they don't just go into deer in the headlights. But I don't think they should understand that and know what it means, but it shouldn't be what they're taught at school. It should be like, here's a basic understanding. And the majority of the understanding should be, this is the TCM point of view. I focus, in my own clinic, I focus on herbs primarily. I mainly just do herbs. I don't even do acupuncture. So when people come to me and they've got like a zillion tests, I tell them, I don't even want to see your test. I'm doing Chinese medicine. I want to hear your symptoms, and I want to get a picture of your symptoms without the cloud or the screen of all these Western tests. Because I want to get my conclusion about your case before I see the results. Then maybe I'll look at the results. But, you're asking a question which quite literally is going to be up for grabs and will be taking shape over probably the next 20 to 30 years in this country, in the healthcare field, is this question of integration. And again, I'm all for having a college of integrative medicine if people want to learn that. But as I always told my former students, and I told everybody who asked me, I went to school to learn Chinese medicine. I did not go to school to learn Western medicine. There are many practitioners, unfortunately, in our field that feel sort of inferior if they don't know Western medicine. They want to, become a Chinese medicine doctor and then go on and become an MD and somehow synthesize those two into something. And I support that, but I don't support the compromise of Chinese medicine in order to achieve those goals. And I think that's what we're really talking about here when we talk about real world versus ideal world in terms of curriculum design. Everyone's getting lost on some level. Nobody's getting exactly what they want out of a program. There was an ongoing debate at Students of Five Branches when I went there, and it still continued up until a few years ago when I was teaching, which is students that want more Western medicine classes and more serious Western medicine classes as part of their program versus students that want more classical stuff and want more Chinese medical theory stuff. And unfortunately, there's just a divide there that I don't know how that divide can be reconciled at this point. So that's a really long answer to your question, but your question is truthfully, that is a question that is going to define the role of Chinese medicine in healthcare.
Yeah, I just wanted
in the
your
coming years.
opinion of what, why it's so important, and so I think you gave that.
Right. Again, I would
Yeah.
always go back to understanding the foundation of the medicine that you're trying to practice.
Right.
Is always going to give you the best thing. Because that quote that I used, it seems so simple. The yin and yang are the basis of everything. That's something that could just sort of gloss over you without really thinking about what that means. What they're saying is that you can to truly master treating disease, all you have to really do is understand the yin and yang dynamics of that disease. We're all beholden to curriculum design, state board requirements. They're always throwing on more state board books, and it's a challenge.
Okay, so we have another comment and question.
Yeah, based on your question, because I just want to mention one thing. Have you heard about that story that six blinded men try to recognize what is an elephant? All of them, they never saw an elephant before. And they just partly get the information. This is similar with what we get from the fundamentals class regarding the Chinese medicine theories. Okay, we take the pieces from Huang Di Nei Jing and make it into a curriculum chapter, but to my personal experience, in China, still in the institutional colleges, universities, when we finish all the semesters, and I still think I don't understand very well about the fundamentals, or there's not a whole good story built up in my mind. Then after I went to read the Huang Di Nei Jing, which is also difficult again. But after I read Huang Di Nei Jing, I feel the system is totally developed. So that's what I want to mention. The pieces not equals to the whole thing. Okay.
Very true.
Thank you. So, Dr. Jing, would you like to step up here with me and I'd like to congratulate Phil on behalf of his chair, Dr. Sonia Pritzker, his committee member, Dr. G, and Heather Thompson, who's unable to be here with us today, that we formally announced you Dr. Garrison